Welcome to Phase 1, Stage 1, Evaluations and Assessments. Please remember that there are challenges. Each phase has a circle group in the Bot Portal community. If you're unfamiliar with the Bot Portal community, the question and answers, the circles, head back to the introduction and rewatch those videos, as there is a lot of good information there that's going to help you succeed and thrive in this course. Complete challenges associated with each stage in this space, and don't forget to ask questions associated with each stage in the corresponding phase. Interaction is going to be very important. We can't learn and grow unless we talk about it, right? That's one of our fundamental components of occupational therapy, is leaving time for that conversation to take place and having that interpersonal communication. That is what drives home learning. So we want to make sure that we're doing that as well. So here's the first challenge. Head to the botportalceus.com, go to the library, click Connect Community, and then Challenges, and you'll find this first challenge here, and it's Make a Friend. It's time to make a new friend. Complete this challenge by posting a selfie and a little bit about yourself in your cohort's circle thread. Include why you are starting this transformation process. Then comment on anyone who sounds like they could be your new friend. And this actually means just comment on each other's threads, as any engagement is good engagement. You never know who is going to help you in the future. Networking is very important, and in our relatively small profession, internationally, right? Not just in the US, but internationally, we're not that big as a profession. So connecting is very valuable. So get to know each other and see what happens. The second challenge you will see in that same space, and that's Complete Occupational Therapy 101 in the Bot Resource Portal. Then share some takeaways. What did you learn? Maybe put a few bullet points there. Look at what other people have done. If you are the first one, that's okay. It's good to be the first one. That means you're a leader, and that is something to be proud of. So definitely complete OT 101. I do want to just touch here for a minute. Occupational therapy 101. That is a huge, huge part of this experience. You may be thinking, well, I just graduated. I don't need to relearn these concepts. I know all of them. Or maybe you're thinking, I've been doing this for a long time. I have a good understanding of it. I don't need to go back and experience that again. And I completely understand. I do. I hear you. I know how you're feeling. But I would like you to consider what learning takes place after experience, or when you're in a different point of your life. You may hear these concepts spoken by a different person and learn something new, or something may be refreshed in you. You may hear something that you've forgotten that you learned, and all of these things are pertinent to clinical practice. I wouldn't have included it if it hasn't benefited my clinical experience in some way. This entire series is on reconnecting with your passion and excellence for clinical occupational therapy. So all of the information you learn in school kind of gets lost, and it kind of becomes muddled because you don't know what you're going to actually need in clinical practice, or you don't know how it applies to clinical practice. This is specifically for clinical practitioners learning how to connect with this foundational information that really does guide clinical insight and flexibility. So I would encourage you to take the time, go through and find one beneficial nugget of knowledge in each video and share that. Everything is beneficial for the development of your vantage point, and I can't stress that enough. You should be able to take one thing away from every interaction that you have in your life, whether it be something that is negative and you say, well, this is something I don't want to do. I don't want to incorporate any of this knowledge. I know what I don't want from this experience. Or if it's, I know that I want to incorporate this with with this person, or I want to continue my knowledge exploration in this area, right? It could go one way or the other, but either way, you should watch these videos. You don't have to agree with them, but you can benefit from them. And we already talked about these daily affirmations. Go ahead and print this out, and every single day, pick one or do them all. Reading affirmations, reading daily affirmations are helpful in aligning our mindset. We are the words that come out of our mouth, right? Out of the fullness of our heart, our mouth speaks. And so we want to make sure that we're remaining positive and trying, making an effort. So please do that. Good. All right, table of contents. So what are we going to talk about in this video? There's going to be 5 steps. Step 1, we're going to understand assessments more. Step 2, we're going to understand the importance of a holistic perspective. Step 3, we're going to apply foundational knowledge. Step 4, we're going to choose objective measures. And step 5, we're going to use SOAP for optimization. This is going to be an important video. So I would encourage you to break it down. If you can't sit and watch this entire video, that's okay. You don't need to. The benefits of a asynchronous course is that you can do it in stride. If you could only get through the first 5 minutes and you need to stop it here, then stop it here. That's okay. There's nothing wrong with that, but do take time to go through. Step 1, understanding assessments. We have 3 types of assessments: an evaluation, a progress note, and a recertification note. An initial evaluation is a comprehensive assessment conducted by the occupational therapist. I do want to note here that there's a difference between a evaluation and just the assessment and just an examination. An examination is the objective measures. You're examining your patient. You're looking at the objective information regarding pathology, body function, body impairment. The assessment, you're assessing different components of this individual's profile. So you're taking the occupational profile, you're collecting the objective measures, and you are going to process that. You're going to think about it. You're going to use evidence-based practice, the 3 pillars of evidence-based practice, and you're going to perform an evaluation of your client. Information gathering includes medical history, tests, and assessments to establish a baseline for future comparison. And the purpose is to determine individuals' needs, develop a treatment plan, and set therapy goals. So that's number 1. That's initial evaluation, and you're going to be doing a lot of information gathering. Sometimes an initial evaluation can span over a couple days. I know some countries, I've had conversations with other OTs that spend weeks evaluating and really getting their feet under them with a client. And so it just depends, right? Second assessment is progress notes. A progress note captures ongoing progress in a person's healthcare journey. The progress is recorded regularly to document response to treatment and changes in condition. And it includes observations, assessments, treatment details, modifications to the treatment plan, and further recommendations. A progress note helps track progress, inform future treatment decisions, and ensure continuity of care. And then finally, a recertification note. A recertification note assesses the need for continued therapy or services. It's required by insurance companies or regulatory agencies to justify ongoing care. It includes updated information on the person's condition, progress, and treatment plan. And then finally, it's an opportunity to reevaluate goals, determine further therapy necessity, and justifies continued services based on functional status and medical necessity. The recertification note will vary in terms of time span. When do you do one of these recertification notes? It just depends on your plan of care and the insurance company, Medicare, who is going to be that regulatory agency. So once we determine the type of assessment that we would use, step 2 is the importance of a holistic perspective. I saw this little illustration here and I wanted to include it. You can see here that there is a difference based on perspective, right? Depending on what you bring to the table will change your vantage point. This individual thinks it's a 6, the other individual thinks it's a 9. When we think about top down versus bottom up, or biomedical versus social, or hence the biopsychosocial, we need to understand that there are different perspectives that different professionals bring to the table based on our ontology, based on our viewpoint or the lens through which we see the world. So a holistic perspective, why is it important? Effective evaluation requires understanding the patient's clinical profile and medical trajectory. It's different, okay? Occupational therapy focuses on the holistic aspect of their occupational profile, but also acknowledges the importance of the clinical profile, so chart reviews and medical history. The synergy between clinical intricacies and the transformative power of occupation can be unlocked through this knowledge. It's a synergy, and that's something that occupational therapy that comes naturally for us. Our history is built in occupation. We've also had a blend towards biomedical approach, and now we're headed back into more of a social approach, but it's important to acknowledge that both are important for us and for client-centered care, okay? So what is the difference between clinical profile and occupational profile? Here you have the elements from a clinical profile. It includes demographic information, medical history, occupational history. So in this regard, it's like the patient's work history, right? Social history, so the patient's living situation, family dynamics, support systems, cultural background, social activities. Current functional limitations, so that's assessments and reports of physical, cognitive, and psychosocial limitations. Rehabilitation history, it's very important that we do a little digging. What is their previous therapy? What interventions were used? What treatments, what treatment approach, treatment methodology was used, and what were the outcomes? How did the patient perceive the outcomes of former therapies? That all impacts their current journey. A clinical profile will also include imaging and diagnostic reports, a treatment plan, physician notes, and finally discharge planning. Remember, discharge planning starts at the first interaction. All right, so occupational profile. What is the difference? Well, we're first going to collect the patient's occupational history. Notice in this statement, it says it's different than the clinical profile, right? Occupation doesn't just mean a job. An occupational history requires a detailed information collection about the patient's past and present occupations, roles, and routines. All of them are important. Occupations here include the 9 dimensions of occupation, the 9 categories of occupation as it is depicted in the OTPF. It includes occupational roles and responsibilities. So what are your patient's roles within the family, workplace, and community? What are the expectations of those roles? Have the roles changed versus their prior level of function? Occupational performance patterns, performance skills, patient's values and beliefs, as that's the common thread or the common vein between connecting everything that we do in rehab. We're going to acknowledge environmental factors, personal factors, patient support system, patient perspectives, and then finally collaborative goal setting. So there is a difference, though it does seem like they overlap a little bit. One is highly objective, much more objective, really the detective in us, and the occupational profile is the relational parts of us. On the BOT portal, you're going to have diagnosis profiles. More will be added, but this is what we have so far. We have a Parkinson's disease profile, ALS, Alzheimer's and other related dementias, or ADRD, executive function, multiple sclerosis, cerebral vascular accident or stroke, and arthritis. I would encourage you to go to the BOT portal and look at those profiles. There's a lot of information in there. So the text within those profiles isn't necessarily searchable, but you can read it. So you can click in and you can see what is in those diagnosis profiles. A lot of them include some great patient information handouts that can guide your education and training, and evaluation tips, treatment tips, evidence-based practice, or research-informed treatments. So I would encourage you to take a look at the content that supports the clinical profiles, occupational profiles, and assessments. Okay, sorry about that. So some final tips for maintaining a holistic perspective, one of which obviously is to combine the clinical and occupational profile. But what are some others? The first is research the patient's diagnosis so you know something about the pathology of their primary diagnosis. This information will shape your plan of care. So I want to stress this. The diagnosis and the mechanism of action that diagnosis takes within the body will change and shape your plan of care. No intervention impacts a client the same way, even if they have the same diagnosis. You will travel down different paths to arrive at the same outcome. Maybe all of your patients require increased independence with toileting. That's your goal for 5 different patients. Based on their diagnosis and how their diagnosis is impacting their body structures and body functions, and therefore performance skills, will change the path that you take to get to the same end result. If you didn't catch that, I want you to stop the video, rewind it, and listen until you understand. The diagnosis impacts everything. It's very important. Next, maintain specific attention to precautions or contraindications associated with the diagnosis. For example, you may be treating a patient who has just had a low back surgery, but this patient also has multiple sclerosis. It is your job to know the contraindications and precautions for multiple sclerosis, even though it is not the primary condition. This is an underlying condition, and you have to know it because it will direct your plan of care. It will direct what you can and cannot do. Next, to serve your cumulative knowledge, organize an electronic resource of information you discover as early in your career as possible. Do yourself a favor and start collecting information and organize that information. You need it. If you're a research-informed clinician, evidence-based practice, right? Client interaction is important. Your expertise is important, but research is also important. That's another leg of evidence-based practice. So I would just start keeping a great database for yourself. And then finally, be intentional and take your time. The more time you spend processing and organizing, the easier it will become for you with each patient you see. So why did I include this? Being a holistic practitioner and having this perspective and being an evidence-based practice or an evidence-based practitioner is exhausting. It's a lot of work, especially when you're a new grad, especially if you're new to this concept of holistic care, right? It's going to take a lot of work outside of your 9 to 5 job, right? It's going to take development. So we don't want to do the work twice. We want to make sure that when we're sitting and doing the work, we are intentional about actually learning and integrating that knowledge so that the next time we have a patient similar, we don't have to recreate the wheel because we've already taken the time to build an arsenal of information for ourselves. So that's what I mean by that. It does get easier, but you have to do the work. Step 3, apply foundational knowledge. So theory, conceptual models of practice, frames of reference, and the OTPF. I hear a lot of practitioners saying, expressing frustration at the amount of theory that's in school and not enough clinical, and that theory, models of practice, frames of reference, they may be a little bit unnecessary, but I actually wholeheartedly disagree with that. Theory, models of practice, frames of reference, and the OTPF, it shapes us. It guides us. It's our framework. It's our foundation. It gives you the justification for your scope of practice and intervention approach. You have to have proof. You have to have something that you can reference that allows the medical community to know that you're okay to be doing what you're doing, that you are justified, okay? It gives you confidence to treat your patient, and it gives you a secure foundation for clinical reasoning, which increases your clinical cognitive flexibility. So step 3 is extremely important. Step 4, choose objective measures. So create a soft plan for the plan of care or treatment continuum. So how are we going to do this? How do we choose the objective measures? Well, let's learn a little bit about it. Assessments and plan of care continuum inform each other in a patient evaluation. Choosing the appropriate objective measures based on your client's diagnosis, activity limitation, or the barriers being presented is important because we have to be able to improve function, and you can't know that you are improving function without objective measures. Okay, so the assessment and the plan of care continuum will inform one another. Like I said, integrating diagnosis, patient chart, and foundational knowledge like theory, models, OTPF, and frameworks brings objective measures to the forefront. We are naturally inclined to choose objective measures when we integrate these concepts within our profession. Objective measures vary between practitioners and settings. A lot can change what objective measures are accessible to you in your setting. You may have a setting that only uses a certain number of assessments, and you have to get your assessment approved every time you want to change the overarching framework that your setting uses. Maybe they only use MMSE, the mini mental examination, versus the slums, and they're resistant to allowing you to use the slums. That will impact the assessment that you choose. Or if you have autonomy, you have a little bit more space and wiggle room to choose what you want to utilize for your objective measure. But do know that it varies, based on preference of the practitioner, etc. Best practice involves using objective measures to help patients achieve common goals. I just explained that. And using assessments in various practice settings like MRU, SNF, and outpatient enhances the specificity of the patient-therapist dyad. My patients love objective measures. Why? Because it allows them to buy into the clinical process. It allows them to see what their goal is, and it makes it more tangible. It's not just a hypothetical positive end somewhere in the distant future. It's okay, I'm going to do these things based on research, and I should be improving. This is something within reason that I can expect that will allow me to experience positive outcomes. That is why we use them. That's why we use these assessments. That's why we use short-term goals or checkpoints so that we can improve this patient-therapist dyad experience. Finally, step 5, use SOAP for optimization. Why do we use SOAP? SOAP notes bring order with 4 sections: subjective, objective, assessment, and plan. The format provides clarity in clinical reasoning and patient history. It's time efficient as you can build upon previous notes for updates. It facilitates collaboration with other healthcare professionals and reviewers. Everybody knows SOAP. I believe it's very efficient. Others believe opposite of that. And it offers legal protection by creating a defensible record of evaluations and treatments. I prefer to use SOAP. I recommend using SOAP. I think there are many positives to it. You can print out the SOAP information handout that talks a little bit more about the benefits of using SOAP. You can also watch the video about SOAP on the bot portal. I believe that's included with OT 101, so I'd highly encourage that. And check out those resources. But with that is the finality of the first stage, evaluations and assessments in phase 1. I will see you in stage 2.